Welcome in to Your Health, and we have some wonderful folks with us today from the Baptist Health System, and we have Lynn Parker, who is the CEO at Crossbridge Behavioral Health, and we have Michelle McClendon, who is in charge of the treatment there. And we have talked about this before, and I'm so glad that we finally have a facility like this.
Yes.
And Lynn, you're located again?
We're at 4385 Narrow Lane Road, and people know it's between our residency program and John Knox Manor.
Right.
So it's
just a little bit south of
the
southern
there.
boulevard there. Right.
And then we have an outpatient program that's located on the campus of Baptist South in one of the townhouses.
Okay. Okay.
So basically then, and Michelle, you could probably answer this, a person comes in for treatment, it can last anywhere from maybe a couple of days to maybe a couple of weeks.
Yes,
and
exactly.
then you leave them with a program to maintain good mental health as they leave.
We want to refer them, and we do refer them to an outpatient facility. That can vary. It might be Montgomery Mental Health. It might be their private. They may have come to us from a private psychiatrist, and we would refer them back to them. Or we might refer them to a program such as our outpatient program, which is a partial hospitalization program. And in that they go during the day, participate in group sessions with other patients, and then they go home at night. So it's kind of like a step down. So there's a variety of different treatments available when they leave us, and we want them to have the most appropriate one for them.
Well, that's great.
That's an excellent plan. What is the age range normally that you treat? Is it all across the board?
Well, we treat from 19 all the way up, you know, because we do care for adults and geriatrics. And so we start at 19 and go up. We don't do adolescents, but we do care for those two populations.
Now, I know one question that will probably come to mind, and we'll just get a general idea, but what about insurance?
Well, most private insurances through employers and private do have some type of psychiatric services in their plans. And with other patients, we work with them on maximizing their resources, what they can, what they have that they can utilize. But, you know, we encourage patients that are in crisis or need help to come to the ER and seek treatment. Don't wait. If there's an emergency or urgent, you know, come and we'll figure out to work with them in some way. But the main thing is for them to get care. Don't ignore symptoms of urgency and mental illness.
And a lot of times if a patient's on medication for something, because, you know, obviously when you watch television and you watch commercials and they say, take this to quit smoking. However, if you have suicidal, you know, so I mean, obviously that can cause a mental condition to happen. And then at that point, they probably need your help at that point, do they not?
Yes, they would need our help to help regulate that medication and to make sure those feelings were coming from the medication, or those symptoms were from the medication.
Very good point.
And to be treated regardless of where they're coming from.
To be
I mean,
evaluated
if I was going to commit suicide, I'd just take a cigarette and smoke again.
That's true.
as the alternative.
Stop
you know.
smoking.
No, you don't need to smoke.
But a psychiatrist needs to be, an assessment needs to be done, and someone make a decision, a professional, about the next steps.
And a psychiatrist, obviously, he's trained to understand the effects of medicine on, you know, on the mental condition of a patient.
Yes. Much of what we do is stabilizing and changing medications.
Because nothing against the medical doctor, because I think they're wonderful, but a lot of times they prescribe something, but, you know, sometimes they really don't know all the total effects of the thing.
Well, and a psychiatrist is basically a specialist in mental health. Just like if you had cancer, you would see a doctor that specializes in cancer. So with a mental illness, you know, it's usually best to see a doctor that specializes in mental illnesses, because that's, you know, that's where they spend their time, and they're the experts at that.
And they work in partnership, because, you know, more and more we're seeing where you have medical issues and mental health issues, so they need to work together as partners, and that's why we have psychiatrists, but also medical physicians that work in our facility to see patients.
Now, you call your team caregivers. What do your caregivers there do?
Well, we have a big team. We have psychiatrists, as we've talked about. We have therapists and social workers who works with our patients to make sure that they are receiving treatment, and also that their discharge plan is in place when they leave. We have nurses who specialize in mental health who work daily with our patients. We have mental health techs who work with our patients, and we have, of course, our medical doctors, as Ms. Parker mentioned, who comes in and helps us see about their medical needs.
Okay, and then they leave your facility with a plan, and I think that's so important.
That's right.
How grateful family members
And the name
must
of your
be.
facility, adequately with Crossbridge, because that's another bridge we're crossing in life, and a lot of times it's a very difficult one.
It is, and you know, one thing that Michelle and I and our team are really committed to is trying to tell people that it's not a stigma to deal with mental illness. It's no different than having diabetes or heart disease, but we still stigmatize it in some ways, and we're trying to get the message out that it's just like anything else. When you need help, you need to get treatment.
That's right, and I don't know anybody who hasn't been a little mentally ill at some point or another.
Yes.
I know I sure have. So,
Well,
thank you so
ladies,
much.
we thank you so
Thank
much,
you.
and just remember this: if you feel like you're depressed, it can be a natural thing, but if it gets to the point where it's just overwhelming, help is available, and we'll be right back right after this.